Hello, friends. If you have Medicare Part D and you take ELIQUIS, JARDIANCE, XARELTO, Januvia, Farxiga, Entresto, Enbrel, Imbruvica, Stelara, Fiasp, or Novolog, look at your latest pharmacy receipt, not next month. Look at what you paid in 2026, because Medicare's first negotiated drug prices are now in effect, and these are the first 10 selected drugs covered by the program. For some people, the change may lower the amount paid at the pharmacy. For others, the savings may appear differently because of a deductible drug tier, coinsurance, extra help, or the point in the year when the prescription was filled. But you should not assume the number on the receipt is correct just because the pharmacy printed it. You need to know which drugs are included, what Medicare negotiated, what those figures actually mean, and what to ask if your cost still looks too high. Stay with me, because I am going through all 10 drugs. I will also explain the biggest misunderstanding about these prices, the 2026 out-of-pocket limit, and a 5-minute check that could uncover a coverage or billing problem before your next refill. The Centers for Medicare and Medicaid Services selected 10 high-spending, single-source drugs covered under Medicare Part D for the first round of direct negotiations. The negotiated prices, officially called Maximum Fair Prices, took effect on January 3rd, 2026. CMS estimated that about 8.8 million people with Medicare Part D used at least one of these selected drugs in 2023. The agency projected that people with Medicare prescription coverage could save a combined $1.5 billion in out-of-pocket costs in 2026 under the standard benefit design. That is a major change, but it does not mean every person receives the same discount. It does not mean the negotiated price is automatically the amount printed under You Pay. Your cost still depends on your plan. Deductible, copayment or coinsurance, extra help, pharmacy, quantity, strength, and how much you have already spent during the year. The negotiated price is the lower price made available under the program before your plan's benefit rules determine your share. It may reduce coinsurance and other costs, but you still need to read the receipt in the context of your plan. Now let us go through the 10 drugs, beginning with the medication used by the largest number of Medicare beneficiaries. The first is ELIQUIS. ELIQUIS is commonly used to prevent and treat blood clots. CMS reported a negotiated price of $231 for a 30-day supply in 2026. The agency compared that with a 2023 list price of $521, a 56% difference. ELIQUIS was used by roughly 3.9 million Medicare Part D enrollees in the CMS data. But the $231 figure is not a promise that every person will pay that amount. Some plans use fixed copays, some apply a deductible. Some people already pay less through extra help. Compare your 2026 receipt with the amount shown in your explanation of benefits. If the pharmacy receipt and the plan statement do not match, call the plan before the next refill. The second drug is JARDIANCE. JARDIANCE is used for diabetes and may also be prescribed for heart failure or chronic kidney disease. CMS listed a negotiated price of $197 for a 30-day supply, compared with a 2023 list price of $573, a 66% difference. Nearly 1.9 million Part D enrollees used JARDIANCE in the reported year. Ask whether your plan applies a deductible, which tier the drug is on, and whether your pharmacy is preferred. Two people taking the same medication can pay different amounts because they chose different plans or pharmacies. The third drug is XARELTO. XARELTO is used to prevent or treat blood clots and reduce certain cardiovascular risks. CMS listed the negotiated price at $197 for a 30-day supply, compared with a 2023 list price of $517, a 62% difference. About 1.3 million Part D enrollees use XARELTO in the CMS data. Blood thinners are not medications you stop, skip, split, or replace without talking to the prescriber. If cost is a problem, ask the plan whether the claim was processed under your current coverage and ask the prescriber about medically appropriate covered options only when necessary. The fourth drug is Farxiga. Farxiga is used for diabetes, heart failure, and chronic kidney disease. CMS listed a negotiated price of $178.50 for a 30-day supply, compared with a 2023 list price of $556. The difference was 68%. Roughly 994,000 Part D enrollees used Farxiga in the reported data. If a claim is rejected, ask whether the problem is price, formulary coverage, prior authorization, quantity limits, or an incorrect pharmacy claim. Those are different problems and require different solutions. The fifth drug is Januvia. Januvia is used for diabetes. It received the largest percentage discount in the first group when compared with the 2023 list price. The negotiated price is $113 for a 30-day supply. CMS compared that with a 2023 list price of $527, a 79% difference. About 843,000 Part D enrollees used Januvia in the reported year. That 79% is not automatically your personal discount. A person who already had a low fixed copay may not see a 79% reduction. Someone paying coinsurance may see a more noticeable change. Ask how your plan calculated your exact 2026 cost. The sixth selected drug is the group of insulin products that includes Fiasp and Novolog in the listed forms. CMS listed a negotiated price of $119 for a 30-day supply, compared with a 2023 list price of $495, a 76% difference. Approximately 785,000 Part D enrollees use these products in the CMS data. Insulin has an additional protection. In 2026, cost sharing for a month's supply of covered insulin is generally the lowest of $35. 25% of the Medicare maximum fair price, or 25% of the price negotiated by the plan. If you are charged more than expected for covered insulin, ask the pharmacist whether the claim was billed to the correct current Part D plan. Then call the plan and ask whether the correct insulin cost-sharing rule was applied. The seventh drug is Entresto. Entresto is used for heart failure. CMS listed the negotiated price at $295 for a 30-day supply, compared with a 2023 list price of $628, a 53% difference. About 664,000 Part D enrollees used Entresto in the reported year. The 2026 Part D benefit also limits annual out-of-pocket spending on covered Part D drugs to $2,100. Once spending that counts toward the limit reaches $2,100, the person pays nothing out of pocket for covered Part D drugs for the rest of the calendar year. This cap does not include premiums or every health expense. Your explanation of benefits should show your coverage stage and the amount counting toward the annual total. The eighth drug is Enbrel. Enbrel is used for conditions including rheumatoid arthritis, psoriasis, and psoriatic arthritis. CMS listed a negotiated price of $2,355 for a 30-day supply, compared with a 2023 list price of $7,106, a 67% difference. For a person paying coinsurance on a high-cost drug, a lower underlying price can matter greatly. The annual $2,100 out-of-pocket cap may also be reached quickly. If your EOB says you have reached catastrophic coverage and the pharmacy still charges you for a covered Part D drug, contact the plan immediately. The ninth drug is Stelara. Stelara is used for psoriasis, psoriatic arthritis, Crohn's disease, and ulcerative colitis. CMS listed the negotiated price at $4,695 for a 30-day supply, compared with a 2023 list price of $13,836, a 66% difference. CMS has used Stelara as an example of how a negotiated price could help someone paying coinsurance while emphasizing that actual costs depend on the plan's benefit design. Do not believe a post claiming every person taking Stelara now pays one universal amount. Part D plans can have different premiums, deductibles, pharmacy networks, and cost-sharing designs within Medicare rules. The 10th drug is Imbruvica. Imbruvica is used to treat certain blood cancers. CMS listed a negotiated price of $9,319 for a 30-day supply, compared with a 2023 list price of $14,934, a 38% difference. Cancer medication coverage problems should be handled quickly. If a specialty pharmacy cannot process the claim, ask for the exact rejection message. Then contact the Part D plan, oncology office, and pharmacy. Do not accept a vague answer like Medicare does not cover it, without asking whether the issue is authorization, pharmacy network, quantity, timing, or claim processing. Now let us clear up the biggest source of confusion. 3 different numbers can appear around the same prescription. The first is the drug's list price, often the large number used in news reports. The second is the negotiated maximum fair price established through Medicare's negotiation program. The third is your personal out-of-pocket amount after your plan applies the deductible, copayment, or coinsurance, assistance, and coverage stage. Those numbers are not interchangeable. A headline may say a price fell by 66%, but your receipt may not fall by 66%, because you were never personally paying the full list price. Your plan may have used a fixed copay or other negotiated arrangements, or you may be in the deductible stage. That does not mean the negotiation had no value. It means you must compare the correct numbers. Here is the 5-minute check every person with Part D should do. First, write down the exact drug name, strength, quantity, and refill date. ELIQUIS is not enough. Include the dose and number of tablets. Second, find the pharmacy receipt and your latest explanation of benefits. The EOB should show the prescription, what the plan paid, what you paid, your coverage stage, and what counts toward the out-of-pocket limit. Third, call the number on your Part D plan card and ask 4 questions. Was this claim processed under my active 2026 plan? Is the drug on my formulary? And what tier is it on? Did the pharmacy use the preferred network price? How was my copayment or coin assurance calculated? Fourth, if the medication is one of the 10 selected drugs, ask how the 2026 Medicare negotiated price affected the claim. Do not argue about the list price percentage. Ask for the calculation. Fifth, write down the representative's name, date, reference number, and explanation. If the answer does not make sense, ask for a supervisor or file an inquiry with the plan. You can also call 1-800-MEDICARE. There are 2 other programs to understand. Extra Help can reduce Part D premiums, deductibles, coinsurance, and copayments for people with limited income and resources. Some qualify automatically through Medicaid, a Medicare savings program, or supplemental security income. Others must apply. Do not assume you are ineligible based on something a friend heard years ago. Ask Social Security or Medicare to check the current rules. The Medicare prescription payment plan lets people spread eligible Part D out-of-pocket costs across the calendar year instead of paying the entire amount at the pharmacy. But it does not reduce the total cost. It changes when you pay. It may help cash flow, especially early in the year, but it is not a discount. Do not switch plans in the middle of the year because one refill looked expensive, unless you have a valid special enrollment period. Before the next annual enrollment window, enter every medication and pharmacy into Medicare's Plan Finder. The cheapest premium is not always the cheapest total plan. A useful comparison includes premium, deductible, copays, coinsurance, pharmacy network, and expected prescription use. Let us bring it together. The 10 selected drugs with negotiated prices in effect for 2026 are ELIQUIS, JARDIANCE, XARELTO, JANUVIA, Farxiga, Entresto, Enbrel, Imbruvica, Stelara, and the selected Fiasp and Novolog insulin products. The negotiated 30-day prices listed by CMS range from $113 for Januvia to $9,319 for Imbruvica. The discounts compared with the 2023 list prices range from 38% to 79%, but the number that matters to your household is the amount your plan says you owe after all Part D rules are applied. Check your receipt. Check your EOB, check your formulary, check your annual out-of-pocket total. If the calculation does not make sense, call the plan before the next refill. Do not stop a medication because of a video, social media post, or confusing pharmacy bill. Talk to the prescriber and the plan. The goal is to make sure the 2026 protections are actually reaching the people they were created to help. If this information helped you, subscribe and share this video with someone who uses Medicare Part D. Send it to a parent, spouse, neighbor, or anyone taking one of these medications. One careful look at a pharmacy receipt can start a conversation that saves real money, prevents a missed dose, and gives someone a clearer picture of what Medicare is paying and what they truly owe. I will see you in the next one.